But the other thing was the state health plan. You said something very interesting. As you know, CNIC's been very interested. We want to know what we're paying for our health care. We want to know, is it rising because of reasons? Are there legitimate reasons in the overall healthcare market? Or are they just rising because these are secret contracts? And one of the things that came out in an audit done by your office, and that I thought was so almost scary, was that the auditor, the state auditor, you don't even have access to what the pricing is.
Exactly, we don't.
And that blows my mind. What can we do about something like that? Or is there anything we can do about something like that?
Well, and I guess I don't understand that everybody else that contracts with the state of North Carolina is subject to audit. But these hospitals are not. They can contract with the state of North Carolina, and that's what it is. It's a healthcare contract, as insurance contracts. But I don't still understand how it is that the hospitals can contract with the state of North Carolina, and we are not privy to the information we need to go and audit and make sure, because when you can't track back to the cost of healthcare, and I even did that for myself, and I had a procedure, and I questioned some of the charges on my own EOB from State Treasurer Falwell, saying, everybody look at yours and make sure it makes sense, and mine did not. And so I was speaking with one of the heads of the healthcare system, and he said, well, Beth, we give you this wonderful treatment, and we have all the best experts, and we've had to put the pricing together. I said, wait. I said, I was a cost accountant to begin with. And I know when we priced our product, we started with what profit we wanted to make. And then we worked backwards into what we were going to have to, what's the cost of the product, what goes into the cost of the product, anything else that's associated, but you also added on that profit you want to make. And I said, I was a cost accountant. I know how to back into, and this is why you're charging me what you're charging me. But of course, I'm the state auditor. I audit this particular hospital, and nobody could fix my bill, if you will, because I'm the state auditor, and that wouldn't be fair to everybody else. But you're exactly right, Artis. There is not enough transparency in how our costs are calculated. Not enough transparency. I agree totally.
Well, you just taught me, and I'm sure most of the people watching this, a lot about how cost accounting works. I don't know those things, and most people don't. And so we heavily rely on folks like you who protect us every day, and we just can't thank you enough.